Patients often ask, what is the day of the procedure for LASIK or PRK? What is that procedure day like? So often patients will come in when we're planning their refractive surgery. We'll see them again to reconfirm the measurements before the treatment day. So this may be the second or even third time we're checking your prescription number because we want to make sure we're very accurate with that. And we also may take more measurements of your cornea the morning of. After we've confirmed the prescription number and the measurements of the cornea, we'll typically give patients relaxing medicine in the area as they're waiting to go back. They're usually very calm and comfortable at that point. We'll take them into the laser suite where the patient lays down under the machine, and they'll simply be looking at a light as we perform the procedure. We will use a device that will open the eyelids and keep the eyelid open, so you don't need to worry about blinking during the procedure. We'll obviously numb your eye with eye drops and numbing medicine so your eye is comfortable the whole time. And patients will experience just pressure and water sensation. They won't feel pain during the process. And they'll just have to look straight at a light for a matter of a few minutes as we perform the procedure. Once they're done, we give eye drops to the eye, we remove everything away from the eye, and we take the patient back into the clinic room where we re-examine them before they go home. We want to make sure if it's a LASIK case that the LASIK flap is in good position before they go home, or if it's a PRK case, the patient will have a contact lens in the eye. We want to make sure that's well positioned before they leave and go home.